All right. Well, looks like it's about time to get started. Good afternoon, everybody, and welcome to Healthy Living Together. We're going to spend the next hour together hearing from some local experts in areas of wellness. But before we get started, we've got a few housekeeping items. Make sure that you're muted. You will be automatically muted during this time. Please use the little Q&A function at the bottom of your screen, your Zoom screen, for your questions. Questions will be answered after all of our presenters have had their discussions. And this event will be recorded, and a link will be sent in a follow-up email. Our speakers today. First, we'll have Kari Granz. She's a program coordinator with the Thumb Community Health Partnership, and she'll be talking about man therapy today and the positive impact it's had on men's mental health in our area. And then we'll hear from Balcer with the Thumb Community Health Partnership. Kay is their director, and she'll be talking about Women to Women health program sponsored by the Thumb Community Health Partnership. And then we'll hear from Nicole Beagle. She is the Chief Operating Officer here at Sanilac County Community Mental Health, and she'll be talking about how to coordinate with your primary care physician to ensure your mental well-being. And finally, Karolyn McEntee, Director of the Great Start Collaborative and Parents as Teachers. She'll talk to us a little bit today about Child Abuse Prevention Month and their program Parents as Teachers. My name's Kelly Phelps. I'm an administrative assistant here at Sanilac County Community Mental Health, and I'll be your moderator for today. So man therapy is up first, and then we'll hear from Women to Women. And then we'll have a discussion regarding mental health and child abuse prevention awareness, and then a question and answer time. So let's go ahead and go to our first speaker. That, again, of course, is Kari Granz, and she'll be talking to us about man therapy. Again, please remember to enter your questions in the Q&A box at the bottom of your screen.
All right, thank you so much, Kelly. So today I am here to talk with you all a little bit about man therapy. I'm Kari Granz. I'm the program coordinator for the Thumb Community Health Partnership. And I'm excited to kind of share how we've reached men in our community and how you can get involved in the man therapy and addressing men's mental health. So some learning objectives that I hope you can take away after this presentation is just learning a little bit about what the Thumb Community Health Partnership is, how we have utilized man therapy, what man therapy is, and how, again, you can get involved in helping promote men's mental health. So what the Thumb Community Health Partnership is a collaboration across 4 counties. It includes Huron, Sanilac, Tuscola, and Lapeer County. We have hospitals, health departments, community mental health agencies, the Human Action Agency as the Human Development Commission, as well as those psychological services and Great Lakes Bay Health Centers. This collaboration was formed in 2019, and we are currently grant funded and are looking at addressing the health needs of the community in the 4 counties that we work with. And so with that, the partnership has 2 kind of priority areas of focus, one of those being behavioral health and the other being chronic diseases. These priorities were identified during review of the health data that's collected here in the 4-county region, as well as just information that they have within their agencies about what needs to be addressed here in the community. And so kind of with that, as Kelly had mentioned, Our Women to Women program falls under the chronic disease, and then our man therapy falls under the behavioral health spectrum. And so why is it important to be addressing men's mental health, and why the Thumb Community Health Partnership is doing this? And so in 2020, there were 31 deaths by suicide, and 27 of those were men. As a region, this is an alarming number. And we knew as a partnership that there needs to be additional resources, additional services to help promote and build awareness for men's mental health specifically. And so kind of what Man Therapy is, it's an online resource. It is evidence-based. It uses guy humor and language that resonates with men to help men identify and realize different tools and strategies in which they can help improve their mental health. It's a way to connect with men where they are at. This isn't taking away from traditional mental health. It's just used as a preventative an educational piece to help men realize that mental health is just as important as their physical health. And here are some examples of some of the creatives and things that you guys may have seen over the course of the last year. We did launch in February of 2021. So this program has been out and available for just over a year. So the goals of Man Therapy is to help reduce the stigma around mental health for men, as well as increase male help-seeking behavior and reduce suicide ideation and the rate of death by suicide among men. And here is a little clip to give you a little bit more of an idea of what the site looks like, as well as some other additional information that you can find on mantherapy.org. And let me know if you can't hear this. I did share my sound.
So we created Man Therapy. Therapy the way a man does it. More than merely an ad campaign, Man Therapy is a first-of-its-kind interactive digital therapy platform. At mantherapy.org, men meet fictional psychologist Dr. Rich Mahogany.
When a man faces a serious life problem like divorce, depression, or suicidal thoughts, shouldn't a man have a way to deal with that too? Well, now he does. I'm Dr. Rich Mahogany. Visit me at mantherapy.org.
To get guys to visit the site, we had to talk to guys like guys talk to guys, using humor to break the ice, shrink stigma, and get men thinking about, talking about, and addressing their mental health needs. It's psychology served with a side of bacon.
So that's just a little clip, again, to give you an idea of what you will find at mantherapy.org.
So we created Man Therapy. Therapy.
So some of the tools that Man Therapy provides to men and their loved ones is that there are testimonials from other men showing and really identifying the idea that there is hope and there is help available. And so we've actually created some of our own testimonials from local men as well. And that's one of the clips actually from the McKenzie golf outing from last summer. There are self-help tips and evidence-based tools and educational content to help men really understand what mental health is. Again, using language that they understand. Oftentimes the barrier for seeking help is that they just don't understand. Maybe some of the emotional issues that they're experiencing are really a mental health issue. And then also identifying that there is the National Suicide Hotline available on every single page on the website. So if they are to that point of crisis, they can reach out and connect with the National Suicide Hotline that's available. And so in ways that the Thumb Community Health Partnership has reached men, like I had mentioned, we've created kind of our own videos, again, highlighting local leaders, men across our region. We've done billboards, radio ads, social media campaigns, radio interviews, Google advertisements, and even had some advertisements in the movie theaters as well. So some examples of those. So this is some of our paid advertising. This was on the front page of the paper. We had stickers as well as the billboards. And again, you guys may have seen some of these already out into the community in your community. And so Here are some collectibles. We've created hats and t-shirts, drink koozies, as well as what our social media ads look like. Again, these are targeted towards men. So Facebook users that are men that are in that age range of 25 to 65 is our target population. They are getting these ads popping up on their Facebook as well. And then we've been partnering with local businesses. So car dealerships, taxidermists, farm agencies, jails, factories. These local businesses have provided their employees and also their clientele base with flyers, rack cards, emails, things like that to help really educate and promote man therapy within their business. And now for any additional information or questions about how you can get involved and help promote man therapy, I would encourage you to reach out to me. My contact information will be shared after if you are interested, as well as any additional questions can be put in the Q&A and I can answer those after the other presentations. So kind of with that, I will turn it back over to Kelly.
Thank you so much for that, Kari. If you joined us just a few minutes late, just a quick reminder, as Kari said, to put your questions in the Q&A at the bottom of the screen, and we'll have a Q&A session after all of our speakers have made their presentations. And with that, our next speaker is Kay Balcer, also with Thumb Community Health Partnership, and she'll be presenting on Women to Women and how this program helps women reach their wellness goals. Thank you, Kay.
Thank you, Kelly, and I'm so glad to be here today. I'm going to be talking a little bit about a new program called Women to Women. It has been designed by the Thumb Community Health Partnership for women with chronic disease. It's a 10-week program, and it incorporates the evidence-based program called Better Choices, Better Health. One of the things that is a little different about this program than other programs is that the Better Choices, Better Health program is on demand. And so for people with very busy schedules, sometimes it's hard to participate in a scheduled educational program. We do combine that Better Choices, Better Health with some extra sessions. So the Better Choices, Better Health occurs over 6 weeks, during which time there's a lot of education provided. But before we start that program, we have some Zoom meetings, some open office hours to get to know the women in the group so that not only can they benefit from the on-demand material, but also so that they can have the support they need from people who are closer to them in their own communities. And so we have been very busy with this program. It is online. As I said, there is no in-person required attendance. People can actually use their phone, so you don't even need a computer, their tablet or notebook, or their computer from their own home. So hopefully it is convenient, and you can come as you are. We have had a lot of people who are actual caregivers, which sometimes it's hard for caregivers to get out to an in-person class, and so that's been a convenience for them. One of the reasons we chose this program is for that convenience, but also because of the increases in the number of women who have chronic disease in our region. And the cost right now is free. It is all covered by a grant. And so it is of great value. In addition to the education and the coaching support from our health coach, who is Gail Innes, people also are able to look through some support items that they can request, and up to $100. So that's a benefit for the participants as well. And it's not limited to just one chronic condition. Some programs that you see that are available focus on diabetes or on cancer or another chronic condition, but this is open to anyone with any chronic condition. It could be pain management, it could be diabetes, it could be being overweight, having challenges with thyroid over a long period of time. So it really is open to whatever chronic condition someone is dealing with. One of the things we found is that many women, regardless of what chronic disease, go through a lot of the same struggles and challenges. And so they find a lot of support learning from each other and learning about how to support one another. We have completed 2 series, one in the fall and one in the winter. We actually just started yesterday our spring series. If someone is interested, I know the class is pretty full. We are very excited. We had kind of small numbers the first 2 times, but with any new program, we know that it takes time to grow. And so we have about 15 women engaged right now in our spring session. Very excited to have this larger group to have those group dynamics. The registration is online, and there will be a link later here in the presentation. But once someone registers online, we have found it's very effective for the coach to reach out to them. So if you register for the program or someone you know registers, don't be surprised when you get an email or a text from the coach, who is Gail Ennis. And she does that to set up a time to have a phone call, just to kind of explain the program, to make sure you're comfortable, to answer any questions, and also then shares with you the syllabus, basically what is the class going to cover, as well as some additional information. And as I said, the link to register is here. It is surveymonkey.com/r/W2W. If you have questions, Gail is the expert on this program. So her number is included on the screen here, as well as an email for Gail. You can call, text, or email for additional information. Our next session will be starting sometime in the summer. We don't have it scheduled yet, but you will see about a month ahead of the class. We promote it on social media highly. Gail has done some radio interviews. We put out a press release. And so you can get on a waiting list right now if you would like, or you can go ahead and watch for it by liking our Facebook page, the Thumb Community Health Partnership Facebook page, and we will make sure that we post information about a month before the program begins. And so that's our program.
That's great, Kay. Thank you so much. 2 very helpful free programs from the Thumb Community Health Partnership, Man Therapy and Women to Women. And we know just how closely related our physical and mental health is. So thank you for those presentations. Again, if you have any questions for Kari or Kay or any of our speakers, please put them in the Q&A at the bottom of your screen, not in the chat. Our next speaker is going to be Nicole Beagle. She's the Chief Clinical Officer at Sanilac County Community Mental Health. And Nicole is going to give us some great information about how to communicate with your primary care physician and talk about your mental health.
Sorry, my computer went on mute for a second. So thank you guys for being here. I always love coming to these things because it's really my opportunity to really talk about mental health. And also the most important thing is to recognize how important our mental health is to our physical health. And people just don't recognize that. And so today I'm just going to be talking about why it's important that we're looking for signs and symptoms and things that you can do to help yourself be more preventative and reach out for help and things like that. So one, I'd like to just talk about the hardcore facts. Nearly 1 in 3 people that have a physical health condition have a mental health issue too. And people don't recognize that. It's most often really surrounds depression or anxiety or some type of mood disorder, but a lot of people that are suffering with a long time of physical ailment have some type of mental health issue. And what is really sad is a lot of times that mental health issue goes unnoticed or it goes untreated. And so it becomes very difficult for them to manage their physical health because their mental health is just not stable. We often forget that our mind and body are really in one. we always consider them as separate. For so many years, you would go see a doctor for your medical issues, and then you go see a therapist for your medical issue or your mental health issue. However, we're really finding that if we're not addressing both of them, that we're not really getting good clinical care, and we're really not addressing any of the issues to their fullest effectiveness if we're not considering all of the things that they might be going through. So it's important that physical problems have an increased risk of developing mental health issues, and it's vice versa. Mental health issues, you have a higher risk at developing physical. So people, a lot of times people come in and say, well, that's not going to happen to me, or I don't have that issue, I'm fine. But then we really talk about what things might affect them, basically based on physical and mental health. And I always tell people to literally look at the genetics in their family. If you've ever seen anybody in your family struggling with mental health issues or some type of depression or anything like that while they had a physical ailment, it's something that you just need to be aware of and you need to be conscious of and be watching. Low motivation. When we can't take care of ourselves, our physical and mental health decline very quickly. And so we have to be aware of why that's occurring and how to make sure that we're addressing it. A lot of times people will not engage in physical or mental health treatment because they have a difficult time or have anxiety around concentrating on it or planning it. It's just so overwhelming for them because they just don't know where to start. And so then it becomes a snowball effect for them. They have a lack of support. They don't have a lot of people around them to encourage them. And it really, unfortunately, it's still out there. It's gotten better, but there's so much stigma around mental health. And so a lot of people do not like to reach out because they feel like if they reach out that people will look at them, judge them, or they just don't feel adequate enough. And when you have some type of mental health or physical ailment, sometimes you're less likely to seek the help that's important. So for example, if you have mental health issues, we see a lot of people that struggle to get medical help because they just think, well, I can't get out and do that. I have this to do. I'm overwhelmed with this. And so they're not taking care of their other needs. We see that with medical issues that come in too. They have a lot of medical issues going on. So then they're not taking care of their depression or their anxiety or, any other type of mental health issue that they have underlining. So let's talk a little bit about mental health versus physical health. So a lot of people don't understand there's a lot of connection as far as symptoms when it comes to these two. So depression, people that suffer from depression will complain a lot about headaches, fatigue, and digestive symptoms. Well, those are all things that we look at into the medical community. And so if we have depression and we're not following up with our primary care doctor on some of these issues, it might not be treated. And then when you have headaches, fatigue, and digestive problems, and it's not controlled medically, then your depression is going to increase. Same with anxiety. A lot of symptoms with anxiety, you get upset stomach, nausea, can't sleep, restlessness, they can't concentrate. And so those are all physical symptoms that sometimes need medical help as far as treating to be able to concentrate on focusing on how to calm down as far as anxiety. We also look on the medical side. Diabetes is a lot of times we see a lot of mental health surrounding that. If it's untreated, diabetes can look a lot like extreme depression or bipolar when there's blood sugar levels are unstable. And so you see a lot of increased agitation, irritability, lack of concentration. So if we don't understand that medical component, we can easily, as clinicians, say, oh, well, they have bipolar or depression, when in reality, it might be really their lower blood levels or their unstable blood sugar levels that are really causing those symptoms. And this is the biggest one that people always are surprised when I talk about it. I don't know how many times I've gone to the ER and done an assessment on somebody that's had some type of delusion or hallucinations or disassociation, and come to find out they end up having a UTI that was not treated for like months. So that's how easily our medical issues can interfere with our mental health. And so if we're not recognizing those types of things, or we're not thinking about them, they can easily get out of control. So let's talk about what you can do for yourself to be preventive. Annual PCP checkups are so important. Talking with your primary care doctor about everything, not just your medical. Talk to them about how you're feeling. Talk to them about how you feel inside, because then they understand how to best treat you, not only medically, but if you need assistance mental health wise, they're able to provide that assistance, whether that's through therapy or medication assistance. It's always important that you have a balanced diet. That's like a no-brainer, that everyone tells you that. But the foods that we put in our body really regulate how we feel sometimes. And so sometimes it's really important for people to understand what foods they're tolerable to and what they're intolerable to, because that can really affect somebody's mental health issues. Healthy lifestyles. When I talk about that, I really encourage people to refrain from substance as far as a method to control any type of medical or mental health, because it's just not healthy. And it creates more issues down the line because there's so many underlying things that are not treated. Exercising is always a good thing. Exercising is not only good for medical issues, but people don't understand how it can improve your mental health. And I'm not saying you have to get out there and exercise an hour a day or 7 days a week, but if you just get out and walk or take a break at lunch and just go out for 15 minutes, you'd be surprised how much that changes your mentality and your state of mind. The other thing is seeking help. I can't express that enough. And that's what we've kind of talked about in the other slides. Those are two really good programs for people to reach out and to get support and get help that they need to feel confident and feeling stable. There's a lot of stigma around a lot of different things as far as in the medical community and in mental health. And so sometimes people don't want to seek the help, but I always encourage people, you have to do what's best for you. And that's what we always should be encouraging our neighbors, our friends, is know yourself and know when something's not right. And just like if you were going for mental health, if you're coming here for depression and all of a sudden you're not feeling well and you're having heart palpitations and you think that it's anxiety, you need to go get it checked out because it might be a heart condition. And that's important. And just on the other end, if you have diabetes and you're not eating right, you're not taking your insulin right, and you're having extreme mood swings, you're having agitation, relationships are deteriorating because of it, you need to talk to your doctor about that. The other thing is having a support system. People that you really can count on, people that you can trust, that you talk to, so that they can encourage you even in the moments when you feel like you're weak or unstable. And then most important thing is knowing yourself and knowing your body and mind. You are the only person that really knows what you need. So be in tune with that, be mindful of that, and use it to your advantage to make sure that you're getting the best care for yourself. Because a lot of times if we can't care for ourselves, we can't care for loved ones, we can't be out there for friends, family, all those things. So it's important that we take care of ourselves. So the next slide's just some resources. That's our crisis line. We have a 24-hour crisis line for mental health. There's also the Sanilac CMH line for services if you feel like you need to reach out. And then I also provided the SAMHSA website. It has tons of information on integrated care, which is both medical and mental health care, great tips, ideas, tools, things like that. So I encourage you to investigate that and use that resource or pass it on. Okay, well, thank you. Back to you, Kelly.
Thank you, Nicole. That was very informative. Thank you very much. Next up, and I should say last but very not least, is Karolyn McEntee. She's the director of the Great Start Collaborative, and her organization is doing some great work with our littlest ones in Sanilac County. And she's going to talk to us today about Child Abuse Prevention Month and parents as teachers. Thank you, Karolyn.
Hi, Kelly. Hi, everyone. Thank you for having me with these brilliant professionals. I'm happy to talk about the Child Abuse Prevention Month. It's very near and dear to my heart. As Kelly said, I'm the director for Great Start Collaborative, and I also serve on the board of the Child Abuse Prevention Council. So I spend a lot of time thinking about what's best for our youngest children and worrying about the effects of abuse and neglect that they suffer through. So to that end, I'd like to share with you a statewide initiative that is all centered around prevention of child abuse and neglect. It's called Stand Up for Kids. The assertion in this program or initiative is that every community can stand up to protect children before the abuse occurs. And we'll talk about ways to do that. The initiative actually encourages every citizen to take action towards providing the support that families need. Sanilac's local prevention strategies, which are in place currently, create supportive environments that empower parents and caregivers to raise children in safe, loving, and nurturing environments. So some of these supportive measures are present in many of the places that we frequent. They can be in neighborhoods, workplaces, libraries. Some are in the faith-based spaces, schools, of course, and some of the sporting organizations we have in our community. Sanilac is really fortunate to have funding from Children's Trust Fund, which allows us to provide many of the prevention strategies that we have in place. First and foremost that comes to my mind is the community. It's the baby pantry. So the baby pantry provides families with basic needs, things like formula, if it's available, always diapers and wipes, other resources like clothing for children, anywhere from newborn up to about the age of 6. And the big thing that happens at Baby Pantry is we have professionals there who connect those young parents with other resources and supports that are available in the county. And the neat thing about the Baby Pantry is because it's funded through the Children's Trust Fund, it's free to anybody. And it's not income-based. Anybody is invited to join us there. So that's something we want to make sure that all of our residents know about. Most of the donations there are new or gently used, and they were donated by local residents. Those are our citizens who care deeply about our youngest residents. If it's something that you feel strongly about, you're welcome to join us at the Baby Pantry as a visitor or also a volunteer. We're always looking for volunteers at the Baby Pantry. So be sure to tell all your neighbors and friends about that. The Baby Pantry occurs in Sandusky at Maple Valley twice a month. It's the second and fourth Monday of the month, and those are open from 10 a.m. to 2 p.m. You don't have to call ahead. You can just show up. Secondary to that, at the Baby Pantry, we also have a safe sleep initiative. That's where cribs are made available to help keep our infants safe while sleeping. There's an education piece that goes with it, and those are available through the Child Abuse Prevention Council as well. For our elementary age kids and a little bit older, the 9 to 13-year-olds, in the summertime, the Child Abuse Prevention Council hosts what they call Empowerment Camp. And it's a one-day event, and it's around activities that build self-efficacy in that age group. And it's also free. This year it's August 16th from 8 to 4 p.m. at Camp Cavell. Registration will be available through the Child Abuse Prevention Council's website. It's open to boys and girls from ages 9 to 13. We also do an education piece in the schools through the Child Abuse Prevention Council that's called Kids Have Rights. Kids Have Rights is a prevention program to educate and empower students, the school staff, parents, caregivers, to recognize, prevent, and stop sexual abuse in our community. The Kids Have Rights program is provided in elementary schools, and it's all about body safety lessons and the importance of using the right verbiage for body parts. And we know this is important because when a child knows that they have a caring adult in their lives who will listen to them and believe them and who will help them if they have fears, they're more likely to disclose if something is going on that makes them feel uncomfortable, which could, be a sexual abuse situation or one leading to one, which would be the hope, is that we would catch it before that fact. What else do we have? Oh, our piece de resistance, our home visiting programs. Home visiting programs have been known to promote positive parenting practices and prevent child maltreatment. We are very fortunate, again, that Children's Trust Fund has trusted us with monies to support our home visiting program. It's called Parents as Teachers. It's a very stringent curriculum-driven program, and participants are known to have 22% less likelihood of incidents of abuse and neglect in their homes than families who are not supported through that program. They work closely with the mothers to reduce family stress and increase social connections. These important supports impact the environment that these children are living in. And so we work really hard with 20 families currently, and we have 4 family success specialists in our program, supported through a Parents as Teachers, who go out into the families' homes, or they offer virtual visits if families are not comfortable with that face-to-face right now. We're doing everything we can to make sure that they have information about developmentally appropriate behaviors for their children, how to support those behaviors, and of course, connect them with services like community mental health. Through the Parents as Teachers home visiting program, we're able to offer parent cafes. Well, we partner the Parents as Teachers with our great Start Collaborative Parent Coalition. And so now we have 2 a week, sometimes 3 of these parent cafes. And those parent cafes are intended to support families by giving them peers to discuss in a safe and non-judgmental space. Conversations around parenting styles, hopes, dreams, and gather feedback from other peers and professionals about their relationship concerns and needs. Also connect them with resources that are available. The reason that's so important is because experiencing abuse or neglect as a child is considered an adverse childhood experience, or an ACE, and that hinders healthy development and outcomes as an adult. In data collected by Kids Count of the Annie B. Casey Foundation, 2021, over 25,000 children in Michigan were substantiated victims of child abuse or neglect. That's not a number we should be tolerating. It just shouldn't. ACEs is an acronym for Adverse Childhood Experiences. And adverse childhood experiences encompass a variety of forms of physical and emotional abuse, neglect, various forms of dysfunctional household experiences within the childhood realm. According to research by Nadine Burke-Harris, she's the founder of the Center for Health Wellness and the current Surgeon General in California. She says that folks who are exposed in very high doses to adverse experiences have triple the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And that just corroborates what Nicole was saying. Health is related to mental health. So physical health mental health, they can't be separated. They're just intertwined. So the question is, what can you do? I've got a lot of ideas. And so in terms of that, I would say that you can spread the word about this month being Child Abuse Prevention Month. Everywhere you see these pinwheels, you can be reminded that there are people in our community working very hard to limit the amount of stress that these families are going through so that we can reduce the amount of abuse and neglect that children are experiencing. You can check out the Children's Trust Fund website. You can wear one of these little pinwheels like I have on my my ID card. Plant a pinwheel garden of your own, or you can contact your officials, your elected officials, and educate them regarding the prevention supports I've just told you about and ask them to continue supporting those. Or you can simply reach out to a neighbor, a friend, somebody in the community who you see is feeling stressed, and just let them know that you see them and you hear them, and tell them about the supports that are available in Sanilac County. Or you can donate. The baby pantry is always taking donations. And lastly, you can become a member of the Child Abuse Prevention Council and help spread these prevention strategies throughout our county. And that wraps it up. If you want to reach me, my name is Karolyn McEntee, and you can reach me at the Sanilac ISD on Jackson Street in Sandusky. My number is 810-648-2200. Extension 4108. Thanks for having me.
Thank you so much for that, Karolyn. We're going to transition now to our question and answer time. While we're answering some of the questions that came in already, and you think of something, please feel free to put it in the Q&A. So looking through, Kari, we're going to start with you. And I see a couple of questions out there. So it sounds like participants heard you in your call to assist with promoting man therapy. And the first question is, what promotional or marketing strategies do you find works best for reaching men?
Yeah, so for the Thumb Community Health Partnership, I think there's a few good promotional kind of strategies that we've really identified. One of them is social media ads through our Facebook page, as well as Google advertisements. So those are based on keywords that men are searching. Is it, I'm having issues, is it mental health? I'm looking for mental health in the community. So some of those keywords, and then that's populating the Google ad to come up, and then they are clicking on that. So I would say on that side of things, that's definitely the paid advertising that seems to be working. On the non-paid, it's definitely the word of mouth. Our community obviously is very close knit, and so having those videos and things of men that are in the community, that are willing to participate, that are leaders, it has definitely helped grow the promotion and just awareness of this resource by having those male figures represent man therapy.
Excellent. So share those posts on social media, share them on your personal pages, just get that name out there, get it circulating, and bump it up there in the search parameters of good old Google. A second question for you, Kari. Is man therapy in other areas of Michigan besides Sanilac County, or the region, I should say?
Yeah, so for our license, we covered 4 counties, the Huron, Sanilac, Tuscola, and Lapeer County. But the state of Michigan received a CDC grant that includes man therapy in their 5-year grant. And so they actually launched it at a state level last August. So we have partnered with the state to really kind of coincide with what they're doing, as well as they have a survey that's available on the site That's a pop-up survey that men can complete when they go to that site. So we're hoping to kind of get that data maybe from some of our users, and then be able to, again, use that kind of as a gauge of how we're reaching men and how they are liking the site. So if we do plan on continuing this after our grant year, we can do so with that data.
That's wonderful. So you get some really good solid data of the men that you're reaching.
Yes.
That's great. Okay. Not seeing any others at this time for you, Kari, but I do have a couple of questions for Kay. The first one is, do I need a doctor referral to participate in Women to Women?
No, it is self-referral. You obviously can find out about the program from your doctor, but you don't have to do any necessarily physical activity. We, of course, include information in the program on basic nutrition and exercise. So you might want to, if you're planning to do some exercise, check with your doctor. That's always a good thing to do, so you're not overtaxing your body if you're not used to it. But we don't need a referral.
Okay. Yeah, that's a really good point, because some of us may have limitations on the type of physical activity we can do. So thank you for that. All right. Let's see what else we have. Just a second here. Okay. Next question is for you, Nicole. The question is about vitamin D deficiency and how that can lead to maybe seasonal depression. Is that a big issue here in Michigan?
So there's really no research on it that clearly tells us if it really is a problem or not. And that's because vitamins are, they're not regulated through the same process as what medical drugs are. So we don't see a lot of what we consider peer review articles that really help us lead us to believe that there's a correlation. However, sunlight does play a huge part in how our moods are. And so we, a lot of times we find people that will struggle a little bit more in the winter months. For me, I can tell you right now, from December till right now, I find myself really struggling to be motivated, and just because the sun's not out, it's cold. And you just don't have, you're not able to go out and walk, do things. So it's hard, it would be really probably unfair to me to say that it isn't a problem, especially in Michigan, since we have, a long winter period. But is there really data that supports that? There's not any that's significant, but there's a lot of people that benefit from treatment, and they really need to talk with their primary care doctor about it. Because if they feel that they would benefit from vitamin D supplements, they would be able to tell them how much you should take, what's safe, what's not, what the risks are, and what side effects might occur.
And another question for you. The participant wants to know, when do I know when it's time to seek help for my mental health challenges?
So I think everybody's different, and it's everybody else knows themselves more than what I would or anybody else would. But I think when you really need to start thinking about seeking help is if it's really interfering with your daily functions. If you find yourself being overwhelmed and it's hard to concentrate, or it's hard to organize things and you used to be really good at it, or you just feel like you're just not yourself, it's time to at least reach out and talk about it. And talking about it would be your first step. I would recommend talking with your PCP about it. Just saying, I just don't feel myself. I feel different. What does that mean? And then they might recommend, they might do some workup, because it might be a medical issue. Maybe your thyroid's off, maybe, your vitamin levels off, all those things. And then if not, and it still continues to increase, then, maybe more mental health interventions are what's important. I also tell people that, just like you see in the movies, therapy, just to have therapy is not a bad thing. To talk to somebody, to debrief with them. It's not to have a person just to feel like they're not there to judge you. It's, that's really what a therapist's job is just to be objective and just to listen and to help you process what you're thinking. And so there's no harm in it. So if someone wants to see a therapist once a month because they feel like it really helps ground them and helps them maintain some stability, there's nothing wrong with that.
Absolutely. Absolutely. So you mentioned therapy and of course, ruling out any of those physical issues that may be contributing to your mental health challenges. But what are some other treatments available for mental health concerns?
So there are so many different things out there nowadays. And when we say therapy, there are so many different interventions. There's interventions for, evidence-based practices for trauma, for, more depression, bipolar. I mean, there's so many different things that we can use as interventions that it's not just talk therapy. That's what I hear all the time from people. It's like, I don't want to sit there and talk, or I don't want you to sit and stare at me and write on a paper. And so I always laugh because I'm like, that's great, because I don't either. Sometimes it might be me just going, and we're going for a walk. When I was a clinician, I worked with kids mostly. And I can tell you the time I picked them up from the school and drove them to the home was maybe the best session I ever had, because we didn't have direct face-to-face contact. So I was able to ask questions and they felt comfortable enough to talk to me, but they knew they didn't have to look me in the face. And so sometimes those rides were just the best intervention for them because they were able to release what they were feeling. But it wasn't traditional. And so there's so many different things as far as therapy. And then of course, medication management, a lot of things we're looking into, like more mindfulness too, as far as like yoga, we have DBT. So we're looking at a lot of other things so we can try to have the least restrictive intervention and not automatically have to go to medications.
Boy, that story about that young person just gave me goosebumps. That's great. That's great. Thank you for that, Nicole. All right, Karolyn, there were a couple of questions for you as well with regards to raising awareness about child abuse. What is being done at the state level to increase the awareness of Child Abuse Prevention Month? Oh.
There's a lot of legislators who are really involved in the prevention activities. And that is an opportunity for people in the community to get out to on Tuesday, April 26th at 11 a.m. on the Capitol lawn. There will be a march to support child abuse prevention in Michigan. So that would be a good way to do that, or just contact your legislator and let them know that you're a proponent of child abuse prevention type activities and supports.
Muted myself there, sorry. So you heard her, get out on to Lansing and march out on the lawn, April 26th. And a lot of interest going on there in Lansing. That's great. There's one more question for you. How do people find out more about Parents as Teachers home visiting program?
Good question. So you can call me. And the other thing is you can speak to your primary care provider. We are in touch with all the doctor's offices here locally. Or you can email me. My email address is McEntee or KMCENTEE at sanilacISD.org. And I'll be happy to put you in touch with the right people. Thanks for asking. You're muted again, Kelly.
Again, all right, let me just double check here, make sure we don't have any more questions. I don't see any more out there at this moment. Any last thoughts that anyone may have? We have just a couple minutes left. All right.
I was really taken with man therapy and women to women and how it overlaps with how we support families. Those are two programs that we could be supporting on our social media, which is fairly active here in Sanilac County. Parents aren't always just one gender or the other. Sometimes they're both. And really, those are the families that we can impact the greatest with those kinds of support. So I'm really excited about sharing that.
Great. Yeah, I feel like we had this whole gambit with this panel that just encompassed basically every demographic here in Sanilac County with strategies for health and wellness. So this was a really great session. I thank McKenzie Health Systems for sponsoring these throughout the year. They've had some really great sessions, providing our community with some much needed information and supports in how to live their best life. And with that, there's nothing else. I think we're a wrap. Thank you everyone for coming. Have a great rest of your day.
Thank you, everyone.
Thank you.
Bye-bye.